my water just broke. I felt like things really intensified.
She was right there and she was coming.
It was an amazing feeling.
I'm gonna cry just thinking about it. I could feel her head.
We heard her cry. We were squeezing hands and she was screaming.
I'm Bryn Hunt-Palmer, and you're listening to The Birth Hour. This podcast is designed as a safe place for women to come together to share their childbirth stories. Stick around and join us to hear informative and empowering birth journeys from women all over the world. Today's episode is sponsored by Fairhaven Health. I introduced you guys to Fairhaven Health a few months ago as the makers of the Milky's Milk Catcher product, and now they are proudly introducing a new line of isotonic paraben-free, glycerol-free, and oil-free products to support vaginal health called IsoLove. The IsoLove line currently includes two products, Baby It, which is the only product specifically designed to be used with Perennial Massage during pregnancy, IsoFresh, a vaginal balancing gel that helps stop unwanted odors and supports a healthy vaginal ecosystem. And coming soon, they'll have Baby Dance, which is a fertility-friendly lubricant that helps supplement natural lubrication during intimacy for trying to conceive couples. Fairhaven Health is generously offering a 10% off code for all IsoLove products when you use Birth Hour at www.fairhavenhealth.com. And today's episode is with Dr. Joanna Ellington, and she shares her birth stories, and then we also spent a lot of time talking about these products that she's developed, and she was just such a wealth of information that I'm actually thinking about maybe having her come on to do an interview more specific to some of these things. So if you guys have any questions, send them my way, and I might do it as like a bonus episode for my Patreon supporters. So keep that in mind throughout the episode if any questions come up, and I hope you enjoy her birth stories and a little bit more information about the work that she's done. I personally had so much fun talking to her, and when we stopped recording, I had a bunch of my own questions for her, so I wouldn't be surprised if some of those things come up for you guys as well. Hi, Joanna. Welcome to the Birth Hour. Thanks for being here today.
Hi, thanks. I'm very excited about talking to you and about sharing my birth stories to help other women and to interact with other women that have shared this unique experience that we all have.
Can you start by telling listeners just a little bit about you and your family?
Sure. So I was actually trained as a veterinarian originally. I was a large animal veterinarian, and then I went back to school and got a PhD in reproductive physiology. And I taught at Cornell University, and my research went from working on animals, valuable stallions and bulls, things like that, into actually human infertility and studying male factor infertility. And during that time, I worked with a lot of infertile couples, and I also started my own family, kind of by accident, actually. And that work led me into looking at ways to help people with fertility issues, and also just in terms of women's health, looking at products that for women's health.
Well, I'm super interested in all of that. I have a lot of questions about that, but let's get your birth stories first. So why don't we talk about your first pregnancy and what that experience was like?
Sure. So in my family, childbirth has kind of always had a mystique because I was born in 1959, and my parents, they had to try to find a hospital that would let my dad be present because men weren't allowed in the hospitals then. And my dad was a PhD in theology, and they found a doctor, an ObGyn, that would let him come to my birth because he was Dr., quote unquote, Ellington. And they gave him a cap and a mask and a gown, and he got to sneak in and see me born. So that was always kind of a big deal in our family. My mom wanted natural childbirth, and at that time they were anesthetizing women and giving them football helmets to wear. So we were always taught that, growing up, that natural childbirth was something you should fight for and that it was well worth it. And my parents were big into nursing and supporting moms with lactation. So I think that was always something really important to me, just understanding that our bodies know how to give birth and know how to produce milk. And then I grew up on a farm. So, of course, there was always a lot of breeding and birthing and lactating in the different animals. And I decided I wanted to be a veterinarian. And then, like I said, went on and got my PhD in reproductive physiology. And when I was 30, for many, many years, I used the fertility awareness method where I would track my cervical mucus, and we would use condoms for protected intercourse when I was fertile, and then not use any birth control during my infertile time of the cycle. I planned our wedding date specifically so we would have a safe day for our honeymoon. And I got the flu right before the wedding. So it set my cycle off. And on our wedding day, I noticed some kind of ovulatory looking cervical mucus, but I was too busy getting my hair done and everything. So we went ahead and, of course, had a wonderful wedding night and a couple of days of a honeymoon. And about a month later, I was not having my period, and I'm normally very regular. So I went and got a pregnancy test, and yes, I was pregnant. So I made an appointment with a local midwife, and my first question was, "How did this happen?" And she was like, "You're a reproductive physiologist. Surely you know how this happened." So it was just, I was shocked because I'd never had an unintended pregnancy before with using the method, but I was kind of careless there. So during our pregnancy, I was the only person I was teaching at Cornell, and there was nobody else around us that had kids or that was pregnant. So that was and I'm the oldest of 6 children. And I'd actually been like, I don't want kids. I'm never going to have kids. So the whole thing was really pretty stressful to me because it just wasn't something that I had thought would happen. But then once we, decided, we were really excited about having Rain as my oldest, and started really getting into being pregnant. And I bought the Active Birth book, and I bought the Spiritual Midwifery book, and found a wonderful group of midwives in Ithaca, New York. And I really enjoyed those books a lot. And I was so excited to see that you had those same books listed at your site.
And people are still recommending them and reading them.
Well, my husband was like, things haven't really changed down there.
It's pretty much the same.
Yeah. My oldest was born in 1992. So it was, I guess, the year Active Birth came out. It was intriguing to see that. So from my reading and my studying, I learned, that perennial massage, antenatal or before birth perennial massage was something valuable to do. And just to back up a little bit, I'm a woman who, when I was in my 20s, I started birth control pills, and they caused a lot of disruptions for my body. I developed provoked vestibulodynia or vulvodynia, which is where you're very sensitive in the vulva and the vaginal area. And so pretty much like any kind of lubricants or wearing tight clothes or anything could give me a lot of pain and discomfort. So I was really nervous about trying to protect my perineum during birthing. And the perineum is, again, the area between the vagina and the rectum, the anus. So that whole area that has to stretch so much during childbirth. And so I read about perineal massage and decided that makes sense to me. If I can stretch those parts out, and just like we stretch our other muscles, that'll help make the process go better. At the time when I started that in 1992, there wasn't a lot of literature on how to do it. They were just saying to do this. And there wasn't really a lot of product choices for how to do it. There were natural oils, or there was KY jelly, but both of those are pretty irritating to me. So we did mostly use oil, but I would kind of change up a little bit what I could use. And my husband and I did the massage together, And we'd started a chapter book, and I would read the chapter book to him while he was doing the massage with his fingers stretching out the birth canal. And it was good because I learned, like, he would stretch too much and it would really burn and hurt, and I'd get mad at him, or he wouldn't stretch enough. And so there was just a lot of communication about me learning that's what that feels like, because you never ever have that sensation at any other time in your life of that perineum stretching side to side and front to back. So it was helpful to me to learn to breathe and to relax when I felt that burning sensation. And I think also helpful to me to learn how to tell somebody, this is what's happening down there. This is what I'm feeling. So that we did the perineal massage. And also I found that it really, a lot of times we would end up making love, which, because it would become erotic. I mean, it's not erotic when it's burning and uncomfortable, but as you start to relax with it and you're functioning as a team, then a lot of times we would end up making love. And it's interesting to me as a reproductive physiologist, because new studies are showing that women who remain sexually active during that last trimester have about 20% lower chance of severe tears in the perineum. So the sexual activity really keeps all those tissues more elastic and more flexible. So without knowing the science, we were doing that with the perineal massage.
Tears are definitely something we all want less of. So
oh,
it's a good statistic to share.
Yeah. And they 27% of women have severe tears, and it's 5 times more common in first-time moms. So it's really, and has so much long-term consequence in terms of postpartum pain, even chronic long-term pain, and sexual dysfunction, fecal and urinary incontinence, just a lot of things that we don't talk about very well in our society. I think the healthcare providers don't want to frighten women, and so they just pretend these things don't happen, which is really not. Obviously, it's better if we're informed and we know that there are things we can do to increase our chances of not having complications.
Right.
So when I was pregnant with Rain, I was in the clinic every day. So I ultrasounded him every day to check him. So I was like, I hope this doesn't hurt him, but he seemed to be okay. I was a pretty nervous mom, just knowing all the things that could go wrong. And the day that he was born, the day before, we were supposed to go for a 2-mile hike, and we got lost and went about 5 miles, which was okay. It was October day in the fall in upstate New York. It was beautiful. I was tired when I got home, and I woke up the next morning and I had some fluids leaking out, just very minor amount, but they definitely smelled like maybe it was the water leaking out from the baby. So we went to see the midwife. She confirmed, yes, that's what's going on, and decided she needed to go ahead and induce me, because at that point it'd been several hours of having the fluid leaking. So my husband and I packed up and drove to the hospital. When I got there, I heard women screaming and swearing, and I was like, no, I don't want to do this. I'm not going in there. But he convinced me I needed to go in. So I had my crystals and my Bob Marley tape, and they set me up for the induction. And I actually went to the hospital I had a midwife, but it was in a hospital setting. But they were great because they let me walk. So I had my induction on the IV pole, and I was just able to walk up and down the hallways in the hospital. And I think as a veterinarian, I have so much confidence in the process. Animals give birth all the time. They have no idea what's going on. Interventions are very low, really. Our bodies know how to do this. And that was kind of the place that I was coming from, was just trusting my body. I wasn't super happy that I had to have Pitocin and have some induction, but I knew that they were going to take it slow and get me where I needed to go. So one of the things that I thought about the most during my labor part was mares, because a mama horse, she has her active labor, her stage 2 labor, is only 15 minutes long. It's the fastest labor and delivery of any species on the planet, because they don't want to lay down on the ground for very long where a predator could get them. And I've helped, not help, but with mares, actually, if you have to help, there's a problem usually, because it's such a forceful labor that they just expel the baby and get back up on everybody's on their feet very quickly. And so during my labor and delivery, I just really tried to have that image of mares, because they close their eyes and they're very, very focused in their body. They're just working with their own body. And so I actually kept my eyes closed through most of my labor, except for the only thing I did was ask for ice chips occasionally. And it's a joke in our family, because I'd always say, faster, faster. I want the ice chips faster, because I would have a finite time between the contractions. And I didn't want to be waiting and go into the next contraction. But the birth itself was fairly uneventful. In fact, I told my midwife when I was done that I thought it was kind of fun. And she was like, that's the first time I've heard that. So I think for a first-time mom, I was really lucky. And Rain was a great kid. He was very easy. I think the other thing with that birth was that I had a confidence in my lactation. I know that 95% of mammals do just fine lactating without intervention. And so when I came home with him, as I started to become engorged, I would just go in the shower and let the water wash over my breasts, and the milk would start leaking out, and it would take a lot of the pressure off my breasts. And I felt like that was really helpful. And when he was nursing, I would just I'd take my shirt off and just wrap a towel around my waist and let the milk flow out, because I think it's important. So if he was nursing on one side, I just let the other side flow out. I think people don't realize that pressure on the nipple stops milk production. And so when we're doing all these different things, because we don't want to leak and we're embarrassed about leaking, we're actually setting up lower milk production. And if you watch a lot of other species, like a cow, if a baby's nursing on one teat, then the other teats are leaking milk, because they're just, she's having this letdown. So again, I just tried to kind of use my experiences from life in other species and let my body do its job. So that's with Rain. I took him outside every day. That was something that my mom's pediatrician had told her back in 1959, no matter what the weather was like, go outside for at least a half an hour every day. That kind of carried forward to, even though we were in upstate New York, taking Rain outside, having the right gear to do that so it was safe. And that he's always loved to be outside, always been a really healthy kid. So I felt pretty lucky about how things went.
Yeah, you answered a lot of my questions of just kind of how your background with animals played into your experience. It seems like it was a pretty big component.
I think it really was. I mean, we had a dog who had puppies, and she wasn't due, but she had them while we were gone for the evening, and we came home and she had 10 puppies, and they were all fine, and they were nursing, and she was fine. I mean, it works. The system works. And it makes me sad when I see younger women just making themselves so confused and wanting something so prospective, prescribed from their healthcare provider. They want a recipe for exactly how it will go. And honestly, the recipe is that it will, in all likelihood, go fine. So just relax and let your body, take care of it.
Mm-hmm. Okay, so then you had a little bit of a gap between your two babies. So when you got pregnant again, did you plan things pretty much the same, or did you go a different direction?
Yeah. So after Rain was a couple years old, then we started trying again. And I had I was pregnant, and I was in a very minor car accident. I still honestly can't medically explain. I mean, it was just a fender bender, but that night I started having bleeding. I think I was about 16 weeks. And I went in the next day, and the baby's heart rate was fine. But what ended up happening was, over about 5 days, I kept bleeding. And again, I knew enough to know that was not good. And we kept checking the baby, and the heart rate would be fine, but the bleeding, they couldn't stop the bleeding. So I knew that there was, a detachment. And so then one morning when Rain, my son, and I were getting ready for, he was showering with me to get ready for school. He said, "Mom, what's that?" And I looked down, and there was my placenta from that baby in the shower. And I just was screaming. And yeah, it was a very traumatic experience. I mean, I knew I wasn't going to be able to probably hold the pregnancy just at that point, but hadn't quite expected to find it out that way. So then after that, I had a lot of problems getting pregnant. So I was working with infertile couples, and we were having to have timed intercourse trying to conceive. And I was consistently hearing about how the quality of lovemaking and sexual relationship for the couple would go downhill during this time, because sex stops being about making love and it starts to be about making a baby. So during that time, I was also still doing my research on how sperm are stored in the fallopian tube. So if you think about sperm in humans, they're inside the scrotum, in the testicle, and they have to be outside the body because it's too hot in the human body for them. But once you have intercourse, those sperm are stored in the fallopian tube of the woman, and they live there for days to maybe even weeks in some cases, waiting for the egg to come. And so my research was looking at what the sugars were in the fallopian tube that protected sperm and helped them to live there safely at that higher temperature. And I had discovered this tree sugar called arabinogalactin, which it's from larch or tamarack trees. The trees in the forest don't rot. The stumps stay there forever. So it's a problem, because if they've logged a tamarack forest, then there's stumps that just stay for decades in the forest. So I was like, that's the sugar, the arabinogalactin had a lot of similarities to the sugars in a woman's fallopian tube that protect the sperm. And in particular, it protects the sperm's DNA material, the genetic material. So I was studying this sugar, and I was having these conversations with my friends and the patients I was working with that were infertile, and we were having our own fertility problems. And one of the things that I was realizing is that all the lubricants that were on the market at the time killed sperm. So KYs, Astroglides, all these products were reported in the medical literature to kill sperm equivalent to contraceptive gels. So very toxic to sperm. And there wasn't any product that couples could safely use while they were trying to conceive. So I started thinking, well, maybe I could use arabinogalactin somehow to protect the sperm and make a lubricant that didn't harm sperm and that didn't interfere with fertility. And one of the other things that started really coming up during this time was that even though there were 16 different published medical papers about how bad these lubricants were for people who were trying to conceive, a lot of doctors didn't know that information. And that was kind of ironic to me, because in the veterinary world, if you have Secretariat breeding mares, or you have a $500,000 bull breeding dairy cows, they don't ever use those lubricants because they know that they're really bad for sperm. So it was a time when I was able to kind of take that veterinary medicine knowledge again back into human medicine. And what was happening was these other lubricants did not contain a spermicidal drug, so they were labeled as non-spermicidal. but that's not correct. They were very spermicidal, meaning they did kill sperm. So as I was working on developing what would become Pre-Seed, that as the first lubricant that FDA said could be used when you're trying to conceive, we had to have a discussion with FDA that the use of non-spermicidal with lubricants that were actually killing sperm was very confusing and causing public health concerns, because you have infertile couples who are having a lot of timed intercourse. They're not having natural lubrication. They're using a lot of lubricants that could kill the sperm. So I spent several years working to develop a lubricant that had the rabenogalactin in it that didn't harm sperm. And there was a lot of testing at home that happened with that product, and then testing in the laboratory too. Basically, my belief in developing products is if I can't use the product, then it's not the right product. So I would have little centrifuge tubes all over our bathroom and our bedroom, different recipes that I tried. And finally, in 1997, we were able to get pregnant. And then later on, we went on and commercialized Pre-Seed as the first product that FDA cleared, meaning you could use language saying that it was safe to use when trying to conceive. And that was primarily because the salts in the product were the same as the salts in our body. The pH was the right pH for sperm. And it had lower levels of preservative that didn't harm sperm.
That's so interesting. I feel like you said, that's just not widely known at all, that's an issue.
Well, it amazed me, honestly, that you could have people who are trying to, years to conceive that are using products that are killing sperm. I mean, it was really sad to me, honestly. And it became like the whole getting into that world of the infertile couples. There's a good percentage of them that will not go on to have children. And so that primary relationship with the couple is so important, and it just gets beat up in the process. So to me, the sexuality of the couple, there's a lot of loss of your sense as a woman or a man, that your body's not working right. And our society kind of always puts infertility around female issues.
Yeah.
But I actually had one of the first grants from NIH to study male factor infertility, and the problems for men when it's a male factor. I mean, their loss of libido, their erectile function. I mean, it can just be really a serious problem for the couple. And even though we talk about it more, we always talk about it again as like a quick fix, like you're just going to walk into the clinic and have IVF and it will all be perfect. And that's not really quite how it goes. So right. I'm very, if you can support people to get pregnant naturally, of course, the healthcare industry doesn't make as much money, but it's much better for everyone involved if you can do that. And I think that's part of, on my journey, it's been, why are we not just supporting the natural ways as best we can, putting the funding, all our knowledge base into enhancing and optimizing natural outcomes, and then using the interventions when we need to instead of jumping right, to the interventions. But that's a little bit of my soapbox on that.
Yeah, well, I feel like you hear that anecdotally all the time too, and we've had people on the podcast as well that, tried every treatment recommended to them. And then when they finally said, you know what, we're just going to stop trying, that's when they got pregnant, because they weren't actively trying. So, and I know that, you just hear those stories a lot. I don't know that there's really much research around it.
Oh, absolutely. Because once you start having those high cortisol levels, they interfere with your sex steroid production. So you have high cortisol, you're going to have lower testosterone. That means you're going to have lower quality sperm. You're going to have lower estrogen. That means you're going to have lower quality egg formation, lower cervical mucus production, everything. So yeah, if you can just help support the natural pathway and give people information. I mean, some people are having sex every day. And honestly, the data suggests that if you, during that fertile window, if you have sex every other day, you might have a 5 to 10%, maybe less chance. But if it's ruining your marriage, to be trying to have sex every day when you don't want to, is well worth the payoff of just calming down a little bit.
Right. Yeah. There's you get so much information of, the rules of do it, every other day, and he can't, masturbate in between and all these things that just stress everyone out.
Right. And it's actually the opposite, because testosterone levels are highest in men, and testosterone level ties back to sperm quality. So sperm numbers and quality are higher with men who ejaculate a lot. So for couples that are trying to conceive, I think it's best if the man's ejaculating every 3 days. And that can be like together, alone. Just know that that's really good for him, because they don't keep. There's no such thing. They just degrade.
Right.
So, going ahead and having frequent ejaculation. And then the other thing I think that's really important about it is having what I call, quote unquote, gourmet sex once during your fertile time. So, yes, know when you're ovulating, track your cervical mucus. I think that's really one of the best things you can do, because that mucus makes a highway for the sperm. Mm-hmm. That there's actually little fibers in it that line up, and the sperm can swim up those fibers to get to the fallopian tube. Men produce more sperm when they're more excited. So if you have at least once during that you put on the lingerie, you take your time, you have a lot of foreplay, and you really enjoy and have a prolonged lovemaking session, that's going to help him produce the most high quality sperm that he can at that time. So instead of having a lot of not that great sex, mm-hmm. maybe have less, and then have that one session that's really a really fun, really romantic, really bonding time for you. So, yeah, well, that's kind of how I got to conceiving Sage.
Yeah, I feel like I could pick your brain all day about this stuff, but let's hear that second pregnancy and birth story.
Yeah, well, and I was just going to say, we in our family on the kids' birthdays, we talk about their birth story, and for the ones that we know, we talk about their conception story too. Not too much detail, of course, but just you were conceived. Sage was conceived at Mount Schweitzer on a ski trip. And it's fun for them to kind of know where they come from. And again, I think it demystifies the whole process. It's a natural part of life, but we really enjoy telling how they were born too. With Sage, I was, about midnight, I started having some leaking again. We went to the hospital. At this time, we did use the ObGyn, she said, I'm kind of like a midwife, which she kind of is, but she is an ObGyn. And they worked on me for a while and said, no, it's not your fluids. It's not time. So they sent me home at 4 a.m. And my mom had driven a couple hours she wanted to be there for the birth, and Rain was going to also be there. So I went home, and the next morning, the husband went to work. And about 11 a.m., I was like, wow. I told my mom, she was vacuuming. I said, Mom, I really think I'm getting pretty close. So then I was like, yeah, we need to go now. So I just remember standing in the frame of the door. I'd been pretty good. And then I was like, I don't want to do this again. I really don't want to do this again. I was surprised like how I'd forgotten what it was like. But the roads were really snowy, and she was driving. And so I'd go, hurry, hurry, when I'd have a contraction. And then she'd slow down, and I'd go, no, slow down. So I was just like back and forth, making her crazy. But we finally got there. I had called my husband, and she dropped me off at the front door of the hospital. And I knew the elevators were really slow. So I climbed up 2 flights of stairs, and my husband had come from work, and he met me there. And they took us into a room, and she was like, oh, get undressed and pee in the cup. And she left. And then I was just like, had this incredible contraction. And I told my husband, I am having this baby now. So he goes out, running out, and so she's having the baby now. And they're like, yeah, sure, right, whatever. So he was like, no, she knows she's having the baby now. So they came running in, and I don't even know, I couldn't tell you who caught the baby. I have no idea. It was just pandemonium. There were gloves flying and pieces of paper everywhere. And I totally forgot that my son and my mom were in the other room waiting for us to get them. I felt so bad. But it was 10 minutes from when I walked in the door till Sage was born. So I was happy that I made it.
Oh my gosh.
It was ideal in a way, but he was really pretty blue because he had dropped super fast. And so, of course, that stressed me out. And then I did this weird thing, which I couldn't decide about mentioning it, but I thought that I would because I know you have other medical people, that listen to this. So I don't usually use male doctors for down there, and I'm not like, I'm not shy, obviously, but I'm not used to having men like working down there. And there was, I don't know, it was a resident and maybe some other doctor. I honestly have no idea. I would have to read the birth certificate to even know who they were. They just grabbed people walking down the hall to come in. And they kind of I think they were trying to like make me not feel uncomfortable. So they asked what I did. And I kind of like made this whole shift into my professional medical person. And I ended up like just barely noticing the baby, barely noticing my husband, because I was like, we were talking about my research and infertility. And it was just like, in hindsight, I was so sad that I did that. It wasn't anything intentional, but I just felt really self-conscious, I think. And I wanted to feel like equal to them. And again, it wasn't a conscious thing, but just, I kind of went to this, like, I feel uncomfortable and self-conscious. So now I'm going to be my medical professional self. And it took me completely out of my body and the experience. So it was just I thought it was a good lesson for when you're in those moments that are really important and life-changing, just to make yourself stop and not let something kind of pull you out of that.
Mm-hmm. Yeah, I'm sure that there's people that can relate to that. So thanks for sharing that.
Yeah. So we did, the nurse who'd sent us home, like, I don't know, 7 hours before, came in to apologize.
My bad.
I was okay. I would have rather labored at home. But Sage was really colicky baby, and he cried like for the first whole year. I was laughing because he never stopped moving in utero. And I'd asked my ObGyn about it, and she said, yeah, he's probably going to be active when he gets out. So he has been, for sure. And I couldn't, I'd read all the books about how you're supposed to nurse the second baby while you're talking to the first baby. But with Sage, if I didn't go lay down on the bed in the dark, he wouldn't feed at all. So it was so boring. I was just like, I couldn't read. I couldn't do anything. I had to just lay perfectly still in the dark.
Oh my gosh.
Yeah, it was really tough.
And such a big contrast to your first.
Total contrast. Yeah, it was really interesting. But he's always been a blessing. And I just had to laugh because he just left for college. And last year, he said, Mom, I just want to thank you for not really doing anything intense with your life so you could stay home and parent me. And I was just like, I looked at it, I just thought it was so funny to me because we do most of our work from home. Our office is at home.
Yeah.
So funny how your kids like their view.
Yeah, that's so funny. You're like, you didn't notice that there's like, doctor in front of my name, and I talk to people all the time about things other than you. I
know, it was just so funny.
I love it.
Yeah. So that's kind of how, and I did want to say I did the Perennial Massage with Sage's pregnancy as well. And I did have a really minor tear with Rain with my first one, but didn't require any stitches. So I felt I was happy personally with Perennial Massage. You know, as I've gone forward and kind of understanding products that can support the vaginal ecosystem, taking what I had learned with pre-seed and making a product that women could use for perineal massage became something that I was really interested in.
So the product that you made for that, it also took into account like not being toxic to sperm and being good for your vaginal tissues and everything.
Yeah. So what happened, interestingly, and it makes total sense. So we knew from the 1960s until we brought pre-seed to the market in 2002 that these recipes with the high salt, the wrong pH, and then also it turns out just some of the ingredients themselves were toxic to sperm, kind of like, duh, they're also toxic to vaginal cells and the healthy bacteria that keep our vagina in balance. And so in 2010, there was actually a publication that came out and said that pre-seed was, you know, one of the safest lubricants just because it had all these right things going on, and that all these other lubricants were killing the lactobacillus that are the good bacteria that keep our vaginas healthy, and the vaginal cells themselves. So that when people used these other lubricants, they were actually increasing the rate of sexually transmitted disease transmission, which was shocking, right? Because most of us thought these lubes decreased STDs. So in 2013, the World Health Organization came out and said vaginal products should be isotonic, meaning they should have an equivalent salt concentration to your body, the semen and the vaginal cells. But even now, 90% of the products on the market and the leading products all have the wrong salt concentration, like 5 to 10 times higher than it should be. So after we got pre-seed going and actually we were able, you know, it was bought by a large company who brought it into a lot of different stores. And I think almost most people now know about a fertility lubricant as a possibility if they're trying to conceive. I really wanted to work on just, here's the World Health Organization putting out this special warning, you know, in 2013, and really nobody kind of pushing and saying, we need to reformulate these products. We don't need to keep using the same recipes that have been shown to be harmful. No woman should be having vaginal health issues because she's using a product that's harmful. So that's, at that point, Fairhaven Health is actually, they're a company that I had worked with since the beginning with pre-seed. They were one of the first companies that sold pre-seed for us. And there's, at one point, the investors that had invested in pre-seed tried to take my patents away from me. And we were able to win that case and keep the patents and keep making the product the way we wanted with the quality that we wanted, in part thanks because Fairhaven actually came in and made an order for inventory that we didn't have yet, just to give us the cash flow to keep going. So they'd always been a company that I knew really liked cutting edge science and was really supportive of women in business. So I approached them a couple of years ago and said, I think that we should, any product that is touching in this area, we can make it the right salt concentration, the right pH. We can look over the last couple of years, there's been another 15 papers showing that glycerin, propylene glycol, these different chemicals are actually toxic to the vaginal mucosa and their bacteria. So let's just make products that don't have any of that in it. Let's make products that have all the good stuff and not the bad stuff to be kind of slangy. And they were like, yeah, that sounds fun. So we've been able to do, my husband's a doctorate of pharmacy. He and I have been able to design the recipes, and then Fairhaven has been doing a ton of research that we oversee to make sure the safety of the products and then bringing the products to market. So it's been a great partnership.
Awesome. And it gets it out to more people too, because they have so many other products that kind of fit well with yours.
Right, exactly. And they're, they have a wonderful community. So that's been really, really helpful. One of the things, if you look at perineal massage, so I knew I wanted to make, because of my experience, I thought it was valuable. I thought it was something really easy that, really most women should be doing. But I knew that I had trouble finding a product that didn't cause me irritation. Again, I'm this guinea pig. So if I try stuff on myself and it's irritating, then I'm like, no, we're not going to use that. Because I think I'm like at the end of the bell curve of sensitivity. When we went to start looking at making a perineal massage gel, I started reviewing the literature that's happened over the last 25 years, and I was amazed to find out that antenatal perineal massage, or APM, means doing perineal massage, stretching that birth canal before you go into labor and delivery. So there's two types of perineal massage. One is what you do at home from about week 35 to when the baby comes. And then there's some perineal massage that is done in the labor and delivery room. And that's a totally different, that's not what we're talking about today. I was fascinated to find out that the medical evidence, so Cochrane review is a fancy term for when statisticians look at all the medical evidence and they say this treatment helps or this treatment doesn't help. And the Cochrane review says that perineal massage does decrease perineal damage or tearing and decreases pain postpartum for women. So I thought that was really exciting. That's something I had kind of learned as a folk method, now had really good medical evidence around it. But as I was like super excited when I found that. And then I started looking at the medical guidelines from different groups, so like family practice doctors or midwives, and they had misinterpreted a little bit that Cochrane review study. So the Cochrane review said perineal massage is good. In certain cases, we can't find a statistically significant difference. And that got overinterpreted a little bit to say that it wasn't helpful in those cases. So I thought, well, that's not quite right. And I wanted people to have good information on it. So I actually went back and wrote all the authors in that Cochrane review and said, this is what people are saying about what you wrote. Is that correct? And they came back and said, no, perineal massage is helpful. Doing more of it is helpful. It decreases pain postpartum at 90 days. So, over the 3 months of healing, and it decreases the chance of tearing or having to have an episiotomy. So it was really kind of fun to get back into it and be talking to these people that are the top of the top in terms of knowledge, and find out that this is a great practice to help women not tear or not have to have an episiotomy.
Yeah, definitely. Anything I feel like when you're pregnant too that you can do to prepare, it just kind of gives you something to, feel like you're helping to do something to ensure that you have the birth that you're looking towards. I think like you said earlier, we try to control so many things and so many are unknown that it's nice to have something that you can kind of focus on. Right.
So, well, if you look at what's happening with the perineum, so again, 1 out of 4 women are going to have some pretty significant trauma to the birth canal or the perineum, and that percent goes up. It's 5-fold increase for first-time moms. So definitely the first-time moms are the most at risk. And that's because the perineum, our birth canal, stretches by 170% side to side when the baby comes out, and 50% from front to back. So if you think about that, it's a huge opening that forms. And some groups of women have more increased chance of severe tearing. That includes older women, some Asian and Hispanic women tend to have a little bit higher trauma rates. Your women that don't have sexual activity during that third trimester, women who've had an epidural, and I think there's a whole cycle that is a topic for another day of epidurals and other things that happen. And then moms that have scarring from previously. And in the past, they used to think, well, episiotomies will prevent bad trauma from the perineal area, but the data suggests that's not true. So sometimes they're absolutely necessary, and you want to have a provider that you trust to do an episiotomy if it's necessary, but an unnecessary one is not going to guarantee that you don't have trauma and a delay in healing. And one of the things that I think I'm seeing in younger women now is they're like, well, we'll just have a cesarean because then I won't have any problems. But actually, if you look at chronic pain a year after the birth, 22% of cesarean sections women have chronic pain, and only 8% of vaginal delivery women do. So you're really increasing your rate and your risk of chronic pain for a cesarean. Again, are they needed sometimes? Yes. But are they overused? Of course, yes, too.
Mm-hmm. Well, thank you so much for sharing all of that information with us and your birth stories. Are there any other, I feel like you've kind of sprinkled resources throughout the whole episode, but are there any others that you wanted to add?
Well, I think one of the other things I was going to mention was, so the Baby It product is the new Perennial Massage gel that Fairhaven launched in the last few months. And it does have the right salt concentration. It's the right pH for working down there. And if you're in the past, the instructions for doing perineal massage were really confusing and not helpful. And so I actually put a pillow under my stomach and had my husband take a lot of different pictures and tried to do all that we could to make the instructions really clear about different positions that you can use, whether you're doing the perineal massage by yourself or with a partner. And so Fairhaven, at their website, they've got the instructions that we've redone. And I think those are helpful because a lot of women, their hands get tired in doing, you're supposed to do the massage 4 to 7 times a week for 5 minutes. And so you just want to make sure you have a lot of the gel on your fingers to help, keep things lubricated. And the instruction sheet gives you 3 or 4 different positions. So if you get tired in one position, you can do the other. The benefits of the perineal massage are twofold. One is you're increasing the elasticity and the flexibility of those tissues so they can stretch more naturally during childbirth. But then the second is, like I mentioned in my case, when you feel that burning and that stretching as you're pulling on the tissues, you could go, okay, I know what this is. And you could just relax and breathe and not be freaked out, because the first time you're feeling that is in the hospital with a lot of chaos going on. So it's the benefits for women that they've reported are decreased tearing, like we said, less pain, but then also an improved feeling about childbirth. So more women said that they felt confident in control during the delivery, and they also felt that they had more control during crowning itself. So as the baby's head's coming out, if the midwife says, wait, don't push right now, just wait a minute, let things stretch. These women are not, they're less likely to be freaked out by the pain and just react by tensing. So I thought that was really interesting.
Yeah, that is a really good point about relaxing, knowing how to control those muscles and relax them, even in a situation where you're maybe not as comfortable as your bedroom practicing. But
right. And I think it can be, to me, it's kind of helpful when you're interviewing healthcare providers. They should be aware of perineal massage, and they should be supportive of you, because there's no negative data about it. So in fact, they did studies to see if women had, if there was overstretching or their vagina too relaxed or something afterwards. And no, that doesn't happen. So, I think it's helpful if you say, well, what do you know about this? And if they're supportive of it and are up to date on the science of it, that's kind of a good indication, that they're going to be aware of less invasive and also respectful of trying to keep the perineum intact and keep women from tearing.
Yeah, as someone who has torn, that's definitely on my list of questions I would ask any future midwives, and just how comfortable are you with supporting the perineum and even, stitching up afterwards and things like that. I think if you've been through trauma down there, you're even more aware than maybe a first-time mom of wanting to keep it intact as much as possible.
Right. No, I think that's a really good point. And there was actually, I don't know if you saw it, but Mother Jones had an article several months ago called Scary Truths about Childbirth. And I was really upset with the article because the author talked about how doctors, healthcare providers don't want to talk to women about how common perineal damage is. And obviously, we all know someone who has long-term complications from that, whether it's rectal issues, urinary. I mean, there's a lot of complications that can happen. In this article, though, they were kind of slamming the healthcare industry for not openly discussing this with women, which I agree with that part. It should be part of the conversation. But then they didn't talk about perineal massage or maintaining sexual activity during the third trimester again, which has been shown to be helpful. They just talked about cesareans as the solution to it. And so I was really disappointed because I feel like, again, they didn't discuss all the potential complications and costs with cesareans. So as we were discussing earlier, if there's a natural way to do it that works with your body, then let's get all the information out there and be talking about it, not feeling like women are such, gentle flowers that we can't say these things might happen to you, but let's do our very best to decrease the chance of it.
Yeah, I do know which article you're talking about, and I remember having the same reaction. So I can put myself in your shoes reading that.
Yeah. I think the only other thing I did want to mention is there's a lot of discussion on what to use for perineal massage. And in particular, so the everyday lubricants like KY, those again have too high a salt concentration. And they also have ingredients that have been shown to be toxic to the vaginal lining cells and the healthy bacteria. And in pregnancy, that's really important because you don't want to get bacterial vaginosis, which is the wrong bacteria going there because it can cause complications. A lot of people do use oils, natural net-based oils like almond oil or coconut oil. And almond oils actually was found to be linked to preterm labor in a study in Italy where they used that. And the problem with the oils is that they become oxidized and they have chemicals that can cause irritation and inflammation. And you don't really, when you go buy a bottle of an oil, even if it's pure or organic or whatever, you don't know the level of oxidation in that bottle because it can change by how it was produced, how it was stored, all these different things. And the oxidation chemicals are very strong in terms of interfering with our body's natural immune system. I thought originally about putting coconut oil in the baby gel because everybody loves virgin coconut oil. I'm paleo on my diet and I eat tons of it. But as I was studying it, the first thing is it has very strong antibiotic activity, which again, you don't want to kill the good bacteria in the vagina. So you need to be careful of that. And secondly, the most strong of an oil in terms of blocking the water movement across cells. And so in the vagina, every day we have little particles that are excreted, like little sugar particles into the vagina, and the water comes and fills those and makes the mucus. And our body sheds that mucus each day. And that's why we see little bits of discharge on our underwear every day, because that's our body washing out anything bad or dead cells in our vagina. And so I chose against the coconut oil because I didn't want to disrupt that water transfer and that, the natural shedding and cleaning of the vagina. So we decided to go with just a pure water-based product, which is what Baby It is. So that's just, there's actually, again, been a lot of research on vaginal products and what ingredients are safe because of the sexually transmitted disease studies. So it's an exciting time in that we know a lot more about the vaginal ecosystem, and we just can make choices that are more supportive of vaginal health at any time, during our cycle.
Mm-hmm. So is there anything in Baby It that, anyone with like an allergy or anything like that would need to be aware of?
So it's, we tested it is actually called a slug mucosal toxicity assay, which is
it's a mouthful.
Yeah, they take slugs and they put the products on the slugs. Okay.
Okay.
It's a toxicity test that's used in Europe. They actually do it in Belgium instead of doing other types of testing. And what was found is that the Baby It is mild, whereas like KY and Astroglide, they are moderately to severely irritating, and the Baby It is very mild. It does have the arabinogalactin in it, so it has that antioxidant support from that tree sugar that I was originally talking about. And I love arabinogalactin. We use it for all kinds of, that's one other thing I should just mention here. So Baby It is great for putting on any kind of irritated skin. If you've got, a little sunburn or you have dry skin, it's got that arabinogalactin is a strong moisturizer in it. So you can use it postpartum for healing. I found water very irritating to myself when I was postpartum. And just recently, like I had the flu this winter and I got kind of sore down there, and I put Baby It on the tissues and I would wipe my bottom with that to clean up, and it was great. So it's, we've looked at all the ingredients. They're safe for like nursing. If a baby was to, if you needed to put some to protect yourself, if you're getting a little sore. And again, we compared in that slug test, we compared the Baby It to the Burt's Bees baby lotion, and the Burt's Bees was actually more irritating than the Baby It product. So everything about it's been designed to be very gentle and soothing and moisturizing.
Awesome. Well, I know we're going to have a coupon code and probably a giveaway and stuff like that. So I'll go ahead and record that later on in the outro. But I'm going to go ahead and have you kind of say where people can connect with you and anything else you want to share before we end. Does that sound good?
Yeah, sure. So the Baby It product itself is at Fairhaven Health. And I so love vaginal products. Again, my husband and I are doing the design work, and then Fairhaven's commercializing them. We have several new products coming online. So if you can go there, you can read about the Baby It. We also have a freshening gel for women that have issues with odor and balance. Again, the other products on the market have very high salt concentration and have been shown to be quite irritating. So you can learn more about the products there, and the Fairhaven people would be happy to forward any questions that anybody has.
Awesome. Well, thank you so much for taking the time today to share both your birth stories and all of this super interesting information.
Well, thank you. And I really appreciate what the Birth Hour does. It's great. It's good to have community. Thank you.
Thank you so much again to Joanna and to Fairhaven Health for sponsoring this episode. If you guys are interested in checking out some of the products that we talked about, you can go to fairhavenhealth.com and you can use the code BIRTHHOUR to get 10% off. And if you're pregnant and in need of the Perennial Massage gel that she talks about, we're going to be giving away 5 of those to mamas over on Instagram. So be sure to check out that giveaway. I also just started releasing some special episodes over in the Patreon group. So if you're interested in hearing those, you can go to patreon.com/birthhour, or you can just go to our homepage at thebirthhour.com and click Become a Member. And there's one episode up right now, and it's actually a audio journal of my Trying to Conceive journey. And there's going to be another episode of that up on Friday. And then starting in June, we're going to have a special dad series that my husband, Richard, is going to do the interviews for. So it's going to be total dude talk about the guy's perspective on birth, which I've got a lot of requests for. So that's going to be available to Patreon members starting in June. So if you're interested in that, go ahead and get signed up via patreon.com/birthhour or over on the website. Thanks so much for listening. If you enjoyed today's show, head to thebirthhour.com and click Become a Member to pledge your support. And as a thank you, you'll get an invitation to join our private Facebook group and access to exclusive episodes. Your vote of confidence and support means the world to me.